remember, talk to your counselor first. Don't just have someone pull a name out of a hat for you or someone match you with some automatic system. You need to know, I can talk to this person. You need to know, I feel comfortable with this person and I know who they are, I know how they help, I know there's a plan. Those are all very, very key in picking the right counselor for you. Today I'm going to cover a question that we get asked all the time. What's the difference between a psychiatrist, a psychologist, and a counselor? Which one do I need? Which one's going to help me the best? Today I'm going to cover the differences and similarities in detail. If you're interested in seeing more mental health videos, please hit the subscribe button and the notification bell so you can see more great videos as they come out. All right, let's dive in. Let's start with psychiatrists. So psychiatrists are medical doctors. They've gone to medical school and they can prescribe medication. Psychiatrists do see people for counseling, but mostly what they do is medication management. They can offer a formal diagnosis of depression, bipolar, schizophrenia, and they can give you the medication you need to treat those illnesses. Psychiatrists can work in hospitals, they can work in outpatient clinics, and they can work within a counseling practice. What you can expect when you see a psychiatrist is that first session should ideally be 30 minutes to an hour. You really want them to get to know you, get to know your medical history, and get to know what's been going on in your life to give you that accurate diagnosis and to give you the correct medication. Follow-up appointments with psychiatrists tend to be more short, 5 to 15 minutes, but psychiatrists can go 15 to 30 minutes depending on their style of practice. I always recommend someone who will spend more time with you rather than less because this is a very important thing to get your medication right. Psychiatrists often do take insurance, but some don't. And I find that the higher quality ones are the ones who do not take insurance because they offer such better quality care. They will only schedule one person per time instead of multiple people where you end up having to wait and feeling a sense of rush when you see them. So it is important for you to be picky on which psychiatrist you see. You need to feel comfortable, that you can be open with, that you can trust, that they'll get to know who you are and help you meet your goals. Let's talk about psychologists. Now, psychiatrists and psychologists, the name sounds similar, but psychologists has the O's, so that's a good way of remembering it. Psychologists are PhD doctors. They're not medical, they didn't go to medical school, but they're still considered doctors. So what they offer is usually psychological assessments. They also offer counseling more often than psychiatrists offer counseling. And a lot of their training is in offering those assessments and giving an accurate diagnosis. So psychologists can be in a lot of different areas of practice. So they can be forensic, they can be child and adolescent, ADHD testing. There's a whole wide range of different things psychologists offer. And so making sure the psychologist that you choose has the specialty and is experienced in offering the testing that you're looking for or that you're needing. Some do it for court, some do it for school. It just really depends on the situation and what the test is for. Typically, the battery of testing that a psychologist will do can take days or hours, depending on how many you need to do. A good psychologist is one that offers the test themselves. So some will hire staff and have staff perform the test, and then they put that together the data and type up the evaluation. What you really want is a psychologist who has sat with your child or has sat with you and really can get a feel for the small nuance that someone maybe new or fresh would miss. And so that's something really important when you're calling around and talking to different psychologists, is asking that question. Are you the one that performs the evaluations? And always knowing, how are the evaluations structured? So a child may have a hard time sitting in evaluation for 8 solid hours. So asking questions like, how are those tests split up, or are they all done at one time? And so you know your child, you know how long they can sit still so that you can find the psychologist who will meet their needs. All right, so now let's talk about counselors and therapists. Counselors and therapists are pretty interchangeable. They're pretty much the same thing. There are different licenses that we have as counselors and therapists. For example, I am a marriage and family therapist, and another popular one in the state of Georgia is licensed professional counselor. but we do the same thing. We just have a different method of becoming licensed to do it. We went to a different schooling program. Marriage and family therapists, we tend to focus on the whole family system. We work well with kids, couples, and how all of that comes together. But it doesn't mean we can't see individuals. Likewise, a licensed professional counselor, or LPC, they've gotten a lot more of their training in seeing individuals and doing groups. But it doesn't mean they haven't gotten training in offering play therapy for children or couples therapy. So we kind of intertwine and we kind of overlap. And so really finding the right counselor for you is less about those initials, and it is more about finding the right personality fit. So counselors are the ones who will sit with you for 45 minutes to an hour, weekly, bi-weekly, and help you walk through different challenges in life and help you meet certain goals using different theoretical approaches. So a popular one is CBT, another is DBT. Which theory we use depends on what you're coming to therapy for. And so some good questions to ask a counselor if you're interviewing them is, what theory model you use and how much experience do you have in working with whatever you're presenting with. So adults, children, trauma, whatever it may be, or how much of your caseload is whatever you're looking for. So that way you know how much true experience they have, how much they work with this every day. Also, when you're talking to a counselor for the first time, you really want to see how do they make you feel on the phone. Do you feel like you feel heard? That you would feel easy to open up and be honest with that person? Do you find it natural to talk with them, or is it hard? Is there a lot of anxiety in the conversation? That's something really key, because you've got to have that personality fit. You've got to be able to feel open and be able to share your life with this person. If it's someone for your child, it's really thinking through, do I trust this person with my child? That's a really important question. Counselors, we have a master's degree or a PhD, depending on the amount of schooling we went to. We have a lot of support and help to really learn how to be with people and how to help them walk through. At JCAC, we have interns, we have associate level licensed, and we have fully licensed clinicians. So interns, that's the first year. Associate level is the next 3 years after they graduate, and fully licensed is usually 3 years plus. And so depending on what those initials are, will be how much experience they have. But also, the more experience you have, the more you charge. And so it's a balance between getting the right amount of experience for what you need and being able to fit that in with your budget. I hope that helps you in understanding the differences between the 3 different fields so that you know who to be looking for whatever need you may be having. At JCAC, we're happy to help. We're happy to help you think through what next step or which type of profession you should be looking for. So feel free to give us a call or schedule a time for us to call you. Those links are below in the comments. Also, we have some links below provided for you of how to find the right counselor, sites you can look them up. Remember, talk to your counselor first. Don't just have someone pull a name out of a hat for you or someone match you with some automatic system. You need to know, I can talk to this person. You need to know, I feel comfortable with this person and I know who they are. I know how they help. I know there's a plan. Those are all very, very key in picking the right counselor for you. If you would like to see more great videos on mental health, please hit that notification bell and the subscribe button so you can see the new videos as they come out. Also, check out our channel. We have a lot of great videos on depression, anxiety, parenting, and coming up soon, we have a healthy relationship series coming up. Take care, and I hope you have a great rest of your day.